Tests are tools used to detect the presence or absence of disease. In this video, we'll break down the key terms used in testing, including sensitivity, specificity, and resolution. Knowing what these terms mean and why they matter will give you an understanding of how they impact clinical decision-making. Sensitivity and specificity are measures that can be used to calculate how good a test is at correctly identifying the presence or absence of a disease. Sensitivity is the ability of a test to correctly identify patients with a disease. A highly sensitive test has few false negatives. In other words, it's good at ruling out disease. Think of the acronym SNOUT, as in sensitivity rules out. Specificity, on the other hand, is the ability to correctly identify those without the disease. A highly specific test has few false positives. It's good at confirming a disease. Think of the acronym SPIN, as in specificity rules in. For example, if a thoracic radiograph detects 8 out of 10 true lung nodules and misses 2, it's 80% sensitive. But if it mistakenly identifies nodules in 3 normal dogs, its specificity drops. Highly sensitive tests are good for screenings, while highly specific tests are good at confirmation. There are 3 resolution types: spatial, contrast, and temporal. Spatial resolution refers to the smallest object that can be clearly seen on an image. It defines how fine the detail is. Contrast resolution is the ability to distinguish between tissues with similar signal or composition. MRI has high contrast resolution. And temporal resolution refers to how well the modality captures motion over time. When selecting an imaging test, think beyond the modality name. Consider whether you need high contrast or spatial resolution. Is motion important? And is this test sensitive enough to rule out a disease? The examples that follow will show how these imaging principles guide modality selection. When screening for pulmonary metastases, thoracic radiographs are typically used first. They provide good spatial resolution, which helps in detecting discrete nodules, especially if they're mineralized or surrounded by an air-filled lung. However, their sensitivity is limited for nodules smaller than 5 millimeters or those overlapping dense structures. For evaluating mitral valve disease, echocardiography is ideal due to its excellent temporal resolution. It captures real-time valve motion and blood flow, making it both sensitive and specific for identifying regurgitation, valve thickening, and secondary chamber enlargement. In cases of chronic nasal discharge or suspected neoplasia, CT is the preferred modality. Its high spatial resolution makes it particularly effective for assessing turbinate destruction, sinus involvement, and bony lysis. It also provides superior sensitivity for detecting mass lesions and fluid compared to radiographs. If you suspect a brain tumor, MRI is preferred because it offers superior contrast resolution, allowing it to differentiate gray and white matter, cerebrospinal fluid, and soft tissue masses. CT offers superior sensitivity, helping it to rule out subtle mass lesions or fluid accumulations that may be missed on radiographs. Ultrasound is the modality of choice when a gallbladder mucocele is suspected. It offers excellent contrast resolution to distinguish bile from echogenic mucin and sludge. Its real-time imaging capability adds temporal resolution, allowing dynamic assessment of wall integrity and adjacent structures, making it highly sensitive for diagnosing biliary disease. Ultrasound and MRI both have excellent contrast resolution. The key differences lie in depth of penetration, field of view, and tissue characterization. MRI excels at imaging deep structures like the brain or spinal cord, with large fields of view and exquisite detail across multiple tissue planes. Ultrasound, on the other hand, is limited by depth and acoustic windows. It performs best in fluid-filled or superficial areas like the gallbladder, bladder, or heart, but struggles with bone, gas-filled lungs, and intracranial structures. So while both modalities provide high contrast resolution, MRI is better suited for complex, deep, or intracranial soft tissues. whereas ultrasound is ideal for accessible soft tissue structures and dynamic assessment. Understanding resolution types and diagnostic accuracy will help you match the modality to the clinical question, improving diagnostic yield and patient care. Sensitivity and specificity help evaluate test accuracy. Spatial, contrast, and temporal resolution define what you can see and when. For deeper comparisons, check out our CT versus MRI breakdown. Your knowledge and understanding of imaging modalities will help you produce the most efficient and effective diagnostic images.